to connect with you, ask you direct questions, and they learn something or the other from each and every session. So that's why we have invited you, and it's such an honor to have you on board, Dr. Saab. In fact, you will be clearing a lot of these myths of minds, a lot of these questions that everybody has. And today, the topic that we initially had a topic of being an introvert, that would have been a little, that is a very close to my heart topic, but then that would have narrowed the discussion or the entire conversation. So we can keep that as one of the topics. But the more broader topic that we would like to discuss today with you is the present scenario, as in the lockdown, how it has affected the relationships. There could be some relationships that are improved because husband and wife and they have come closer, and there could be relationships that have worsened. And there is another situation which I get to hear. Yesterday they were talking about a situation because they are feeling like a jail. Like a jail, you can't go out, so you are absolutely inside. They're used to roaming around, they're used to going to different places. That is another trauma which is, I think, bothering a lot of people. So we want to hear it all from you, how you get to hear about them from your field. As in, you must be getting so many cases every day.
Yes. Yeah.
So how do you, I would like to know more about what are you hearing, because we are inside we are all locked inside our houses. So we know nothing about what's happening outside. So we want to hear from you, Doctor.
Sure. Can I begin with a couple of stories, which,
please,
couple
please,
of
please.
calls.
The forum is yours. I mean, in fact, I'll go mute, so I want to hear.
Yeah. Just I will talk about a couple of calls which I got recently. One was from a very distraught mother. I see this young boy who is about 15 or 16. And you know that as all of us are locked in now, and we are having the students are having these online classes. So the mother is a working mother. She's a single working mother, but has brought up her son, with a lot of passion. So since the lockdown began, she was forced to stay at home, and the online classes for her son was going on. What happened was the mother started being present during all the online classes. So she was, whenever the child was going online and participating in his classwork, the mom would sit at the back and then start making comments about the accent of the teacher, that the teacher is teaching something wrong, the son has to do this and that. So she was present like a helicopter, which she wasn't earlier because she had to go to work, and the son was going to school. So one day the son got so angry and he said that I want to leave home because I can't constantly have you making snide comments about my teachers, what mistakes I'm making. And the mother said that it's, if you go out, then it will be, it's dangerous. You might get the infection. So the son in his anger said that it is better to die and get corona than to live in the same house as with you. So the mother called me quite distraught and saying that, what do I do? And then I spoke to the son on the phone, and he said that my mother, we have never spent so much time, 24 hours together inside the house. And my mother is making me go absolutely crazy because she's doing a lot of things and she's constantly interfering with my work. So that is one example. The other other side of the story is I see a couple for many years where the wife has been depressed because of, other reasons, her job front. Now, the husband, she always described her husband as someone who is quite aloof, shy, remote. He works in software, so he has to travel a lot. They have been married for about 3 or 4 years. And the wife always felt that the husband was emotionally not available towards her whenever she needed him. Now, with lockdown, both of them are having to stay at home. And the husband is also working, but from home, and he has not been able to travel. The wife called me up and said that, over these last 1 month, he has found a completely, entirely different side to her husband. And she has realized that he's actually a person who deeply cares about her, but is unable to express it in words. So he's quite an introverted, shy person who has doesn't have too many friends, but he has been remarkable in helping her with the housework. He's, looking after her parents who are quite sick. He has been making all the arrangements so that they are comfortable. In fact, he has brought them home, wife's parents home, so that they all can be together. And she, in fact, candidly told me that had this lockdown not happened, I possibly would have always thought that my husband is an uncaring person. So I think, relationships, Mr. Chawla, are at the heart of our existence. And somehow or the other, we have become much more aware about our existing relationships, in all forms, be it husband, wife, son, mother, friends, parents. We are all now much more aware of our relationships, and either we are working on it to improve it, or we have become aware that it is not working properly. So we are trying to, make amends to it. So I think this is lockdown in some ways has forced us to review our lives, and relationships are the most important component of life. So therefore, I think if we just reflect a bit, think about our relationships a bit more seriously, we can work wonders using this period. I think that is something which I feel. And I would really love to hear from, the audience, because I don't want it to be a lecture really. What have been their experience of staying indoors during the lockdown? What are they finding easy? What are they finding difficult? I am also seeing a lot of people who have, who are addicted either to cigarettes, alcohol, and they are not able to get hold of cigarettes or alcohol, and they are getting irritated, they are screaming, shouting, and again, it's taking a toll on the relationship, marital relationship. So overall, I think it would be useful to hear from, the audience or whoever is around, if they have a question or if their views about what is happening in their relationship, and we can take it from there. But I personally think that this is a fantastic time to cultivate new aspects, cultivate new hobbies, and do a bit more about with our own selves.
Okay, thank you. It was a lovely insight. Can we have questions coming in? Can you raise your hands, please? Let us straight away go for talk session where we don't write questions in the boxes, straight away ask. Can you please raise your hand if you want to ask a question?
The other thing which I was wanting also to say, see, this lockdown has forced us to adapt to it. Now, I know there are a lot of negative consequences of this entire pandemic, financial meltdown, financial insecurity is one aspect. But the other positive aspect is that we are now doing things to survive. We are now doing, thinking of ways to survive, which is testing our resilience, which is forcing us to adapt. And had this not happened, we would not have found that side to ourselves. So now I know that I have to live like this, and therefore I'm adapting my lifestyle. So in a way, it is making us stronger. It is making us look for new ways to survive in a world which is going to be different. And I think lockdown has given us that opportunity.
Okay, now if we go like this, suppose in a present scenario, if say for instance a person who is fighting an anxiety or depression right now, because he may be having, apart from the financial difficulties that he may or may not be facing, but this family anxiety, how does he tackle that? How do you expect, or how do you suggest that he should take that challenge, or how he should find remedy?
Yeah, because we have been doing a lot of video consultations and telephone consultations. The main categories of problems which are coming to us are mainly 3 or 4 different kinds. One is, majority of the calls are about how do we manage our own family? How do we manage the lockdown? We are not allowed to go out. We are feeling very frustrated, bored. See, when we are not allowed to do a lot of things, we ourselves get very irritated. So when I am irritated, I'm not happy or I'm not relaxed, my relationships will suffer. So there is a lot of friction which is happening at home, which is new. So we get a lot of calls about that. Then there are a significant number of calls from frontline workers, like police, nurses, doctors, delivery guys, companies which manage essential services. They are worried about their own health and the stigma that we all are reading about in the newspapers how people who are working in the front line are being harassed. So that is another group of calls we are getting. The other group of calls we are getting are mainly from the elderly people who are very, very confused about the loads of information, rumors, fake news. We all are. But the elderly population, in fact, are feeling more confused about how to deal with the lockdown. Should they take newspaper? Should they wash their, whatever the bags with which food come in? So a lot of anxiety and panic. Regarding how do we manage situation at home, my request is that, see, this is a phase which we shouldn't think of this phase as a lockdown, but we should think that we are in a safe place because we have a roof over our head. We are keeping ourselves inside home to keep ourselves safe and our family members safe. So this is a phase where by not going out, we are not only protecting ourselves, but we are also protecting people whom we love. So therefore, I think we need to change the way with which we are looking at the lockdown. And if we are feeling irritated, annoyed, then definitely we have to clearly tell our spouse, tell our children that, look, I need some alone time. Give me about 15 minutes, give me half a day. Just don't I need to come to terms with this frustration. Don't kind of nag me. Don't keep on asking me repeatedly questions. So just stay away. Do something which you like. Maybe listen to music, do a bit of online surfing, read a book. If possible, do a bit of physical exercise so that, we spend some time on our own, calming ourselves down, and then again rejoin, the main family conversation.
But then, see, normally in this particular field, there is no suggestion like in other fields. You have fever, take this medicine. To have this pain, take this medicine. Is there any something like that? I know that what you are saying is making a lot of sense, but it is practically not acceptable to our minds because we are not used to it, and adjusting into this lifestyle becomes so difficult now that we want a solution or somebody wants a solution other than these things which is not working at all. That's why the frustration is building up.
True. No, as I said, see, Sujal, I feel that we have to accept this phase of change and we have to talk to ourselves, our inner self, saying that, see, life is going to be difficult for next 4 weeks, 6 weeks, 6 months maybe. Who knows? Now, what I request everyone to think in these lines that, see, there are many uncertainties. What are the things which produces frustration and anxiety? It is uncertainty. Not knowing where we are heading for, not knowing how long the lockdown will last, not knowing about our financial, status later. So therefore, in order to maintain our mental equilibrium, my suggestion is that we need to think that there are things which we can control and there are things which we cannot control. Let us make a list of things which we can control. We can control our own emotion. We can control our own activities. We can plan our day. We can plan our day in 1 or 2 days at a time. Keep our emotions in check and do the best we can in these 1 or 2 days by not getting angry, not getting upset. So we need to force ourselves to control our minds and our emotions. So our brain should be controlling our emotions, not the other way around.
We have a question from Manoj Jain. Please, he has raised his hand. Manoj Jain, are you there?
I'm there, sir. Good afternoon, doctor. I have a question that how do we come to it's a psychiatric problem? Somebody, I mean, it is very common these days. It's a insomnia. People don't sleep properly. There's always a sleep problem. So, I mean, what is the indicator of a psychiatric problem? If one can, I mean, because it is very difficult to understand whether it's a psychological problem or it's a depression or whatever it is. So, if there's an insomnia, somebody is facing insomnia, so it could be a case of psychiatric also.
No, that's a fantastic question. I'm glad you asked it because there are a couple of parts. See, sleep problems are the commonest problems all of us are facing now, Manoj. You know, if you speak to 100 people, 80 of them are saying that we are having sleep problems. Why? Because our entire routine is very, very messed up. We are sleeping late, we are waking up late, we are not going out of the house, we are not working out, we are not working. So therefore our brains are not tired. You know, maybe we are spending too much time on screen. So therefore for majority of us,
so I'm not talking of this particular COVID situation. It is a normal situation. I mean, how do we come to it's a psychiatric problem? What are the indicators of psychiatric problem?
For psychiatric anxiety and depression, how we understand sleep problem has to be persistent, but not only sleep, our attention, interest, appetite, all things would change, you know. So we would be unable to concentrate in work, we would become irritable, we would be sleeping less, things which we used to enjoy, like maybe chatting with friends, going out with friends, you know, watching a movie, reading a book, we would find them meaningless. We would become irritable. Our interest in working would decrease. And overall, there will be a change in the way we feel, change in the way we act over a period of time, so that it will affect our functioning. So, meaning that suppose if I'm a student, my academics will suffer. If I am working, I will not be interested to work. My business would suffer. And then we would figure out that it is a clinical depression or clinical anxiety and not merely sadness. So apart from sleep problems, you would have a host of other problems also.
Okay. So if it's only insomnia problem, so shall we visit a psychiatrist? No.
No, I think initially we should try some good sleep hygiene measures like sleeping at regular hours, physical exercise, avoiding caffeine and those caffeinated drinks. And if the problems still persist, then you should visit a psychiatrist or a psychologist. See, sleep problems are commonest because of 4 reasons. One, because of pain. If you have a toothache or if you have abdominal pain or if you are unwell, you would not be able to sleep. If there is too much noise, you will not be able to sleep. Then the other reason is that if you are smoking or drinking too much, then you will not be able to sleep. And the final reason for sleep problem is anxiety and depression. So could be many causes of sleep problems, and we need to analyze them and see what is causing it.
So in the case of my mother, she's a senior citizen. For last almost 8 to 10 years, she's not been sleeping in a right time. Like she is awake till 2:30, 3 o'clock. Then suddenly she sleeps for 2 hours and 3 hours. And her total sleep pattern is rather messed up. So like
elderly people do sleep less, you know, about 6 to 7 hours. As we grow older, we do sleep less. So you need to check whether she has about 6 to 7 hours of sleep in the 24-hour cycle. And if it is not happening, then you need to consult, you know, a physician. Often the elderly people take other medicines which can cause sleep problems.
Like hypertension medicines or the cholesterol medicines. This could affect the sleep
many medicines
pattern.
Many medicines can cause sleep problems. Best is to consult the physician. Like asthma medicines often cause sleep problems. But if she's not getting more than 6 to 7 hours of sleep in 24 hours, I think then you need to consult some.
Okay. Thank you, doctor. Thank you so very much.
Okay.
Thank you.
Can I ask a question, please?
Jiten, unmute yourself. Jiten, you are mute.
Yeah, please ask your question. Madam, you can please ask the question.
Shall I ask? Good afternoon, sir. I want to know about depression. Like my daughter is undergoing a depression in the sense she has sudden feelings of sadness, anger, and like she starts laughing and crying at the same time. So I've taken her to a psychiatrist. They're giving her medication. So I want to know, like, physiotherapy and medicines go together?
Yeah. For how old is she? I'm assuming she's an adolescent or
She's 24-year-old. And
24.
yeah.
Yeah, anxiety and depression is quite common at this age, and people, young people do present with a lot of mixed feelings. So, irritability, crying spells, anger outbursts, and medicines and therapy counseling, they do need to go hand in hand.
And sir, what will be the duration? Like this is a long-term process, I believe, a year or
Yes.
two. Does it take?
It's a long-term process, at least a year or so. It depends on a lot of other factors which your psychiatrist will be able to say best. But for some people, it can be even longer.
Okay. So the medicines are safe to take. Like she's been prescribed some medicines, but
Majority of the medicines are very safe, so don't worry about it, because all psychiatrists use uh, you know all psychiatrists use medicines in young people with great caution. So and the majority of the medicines which we use are extremely safe. We all would be worrying if our daughter, if our sister, they are on medicines, because they have got a long term, they have got their career, they have got their relationships. So but the majority of the medicines which are used in psychiatry for depression are very, very safe.
okay. So that is, and with the lockdown going on, also they have this problem where she was going to get a job and they're not getting one now. So all this has added up, so it's become more severe. So and plus she
I think
was showing.
lockdowns are, this phase, are getting a lot of calls from people who have existing anxiety and depression, because many of them are unable to go for treatment. Many of them are unable to access their therapist. Many are unable to get the medicine, and life seems to be on hold for many people. So therefore, it is a difficult time for people who have anxiety and depression.
Thank you,
I
sir.
think as family members, we need to be more supportive towards them and acknowledge that they are feeling depressed and anxious, and not really, react if they are angry and upset, and keep the channels of communication open, which is very important.
Yeah, communication. That is true. And another thing I wanted to ask you, like she was going to a psychiatrist and talking to her, but now suddenly she's not wanting to go and talk to her.
Don't force her. Don't force her.
So whenever she's ready, I take her.
Absolutely.
Okay. Thank you, sir. Thank you so
Good.
much.
Okay, I have a question, Dr. Ram.
Yes, please.
JC, may I?
Yes, of course, please.
Okay,
Yes.
Dr. Ram, how do you there could be a case, where there is a child, about my daughter. I'm talking of my daughter who's 13 years of age. So how do I judge, whether she has got a psychiatric issue or she's pretending it? In the sense, she again have outbursts of, anger and, various kind of things. But is there any means by which I can make out that, she's enacting, or, it's an actual?
No, that's a very, very, thank you for asking that, because, many of us as parents, as teachers, as carers, we are often perplexed whether we should seek professional help or not, or we can deal with it ourselves. And trust me, this is a dilemma which 99% of people feel. So I'm glad that you brought this up. See, mood swings are quite common in adolescence. So if it is not too much, then don't bother. Number one.
It's too much.
If it is, yeah. Now, if it is too much, then is it happening only at the home situation or in school or with friends? So if it is only happening at home and her teachers and her friends are saying that it is not happening with them, then maybe there is something in the home environment which is causing it, and someone who is close to her or a close family member may be starting to have small bits of communication regarding what is happening, why is she feeling like that. But we need to do it in a non-judgmental and non-blaming manner, and also when she is calm. So suppose I'm very angry and upset, you come and ask me why I am very angry and upset and there is no reason to be, then it will not be a very fruitful conversation. Best thing would be for me to settle down. Maybe the next day you open this conversation saying that, what happened? Why did you feel angry? Did I do something wrong? And we need to have these micro conversations on a regular basis. Also, if her functioning, what does a child is supposed to do? Is she talking to her friends properly? Is she going to school? Is her academics okay? If all those parts are okay and they are not suffering, then you can safely assume that it is just a temporary adolescent mood swings, which the family members need to acknowledge and, speak with her in a non-judgmental, non-blaming manner and sort it out.
So where does one draw a line that, yes, it's the right time to go to the doctor in this situation?
The best way would be to speak to her teachers and say that, do they notice any change in her behavior in school? So if the 13-year-old was also behaving in a very irate manner in school, if her friends started avoiding her, if her academic grades are falling, then we would realize that it is a far bigger complex than simple mood swings. So then we need to consult a school counselor maybe to begin with, and then maybe a psychologist or a psychiatrist. See, one of the things which many parents face, because we all more or less, live in a nuclear family, so we don't know whether this is normal for all children. So teachers are often the best guides. They would tell you.
Okay, great. Are you satisfied, Manoj, or you want to ask more? Manoj, are you okay?
Yeah. Perfectly all right. Thank you.
One of the other things which you can do is, when she's calm and when we are having a family dinner, or when maybe you are having a one-to-one time with your daughter, take her out for a drive and just say that, what happened? Why did you feel so upset? Which is very useful. If parents start talking about their own emotions, in the sense that, suppose Manojji, you come back home and say that, today in my office or in with my friends, I had this argument and I felt very upset. Children also learn that they can talk about their emotions. So it is not something which cannot be done. So if the mother starts talking about her own emotions, that she felt angry and unhappy about these things and how she kind of, fought her own sadness, then children also will be able to express their own anger and sadness. So that is also a good way of opening the channels of communication.
I have a private question. Yeah, please ask.
Yeah, hello. How to control the menopause mood swings? And family को कैसे पता चले कि मेरे को menopause का mood swings हो रहा है? How I tell them?
Mood swings, are quite common. And again, I think, if it is too much, then there are most of the times we do give a very low dose of antidepressants, are very helpful. They don't not only help in the mood swings, but also in hot flushes, also on the other physical symptoms. But, family members, I have found that they are quite used to, they understand that this is happening because of the menopause is approaching, and you need to speak to clearly with them. And if it is too much, then do seek medical help, because there is fantastic treatment available for that.
There's a private question that's come up to me. One question I'm reading out. I am now more worried about the situation post-lockdown. Now life dynamics would change. We as a family are very beautiful, set into a comfortable zone. Though there are a few occasional tantrums, but we are happy otherwise. I don't know when this lockdown goes away, the entire thing will change once again.
True. I think we have to, I think we all have to acknowledge that in many ways our lives would be changing. It's not for one family, but I think for majority of the families. Today, I'm not sure whether it's, these days there's so much of fake news going around. I'm not sure whether this is true or not, but I saw a clip from CNBC News 18 that TCS has said that 50 to 75% of their workforce will be working from home.
That's true.
So I wasn't 100% sure whether it was true or not. So just imagine the consequences of that, so our lives in many ways will be different. Our mayor has said that we should be wary of, having the puja this year. Where we go for holidays, if I go to a multiplex and the person sitting next to me is coughing, will you feel comfortable in sitting next to me? So I think in many ways we have to be gearing up for what is called the new normal. There is this, AC and BC. A lot of people are referring to it. Before Corona, after Corona. So the life after Corona will definitely be a lot different. Our teaching mechanisms would change. Our working from home will have to increase. There would be financial upheavals for which we need to be, ready really as much as we can. And also, I personally feel, I know this sounds a bit kind of grandiose and kind of idealistic, but, one of the things which personally for me, this whole pandemic has proved that we need to be mindful about our community. If I'm very rich, that won't save me. I can't, go off in a private jet to another country to seek treatment. My health depends on my neighborhood. My health depends on my immediate community. So we are all dependent on each other, and my wealth, my, how successful I am, how polished I am, how the number of clubs I am member of wouldn't really save me if my next door neighbor is not healthy. So in a way, I think and I hope that this corona will make us more sensitive towards our community, which will be a boom. Which will be a boom.
Okay, did you get your answer, man? Now, next question that we have is from Chetu Singhi.
Hello. Good afternoon, doctor. I want to ask, my husband has been in a long time, has been suffering from in the lockdown chest pain. So I frequently take to the doctor. Yeah, so I have taken him to doctor. His ECG is normal, his treadmill test is normal, and but in the night times he often face anxiety, breathlessness, and in the morning he's so, and I'm telling him to let's go for a testing, but he said I don't want it to go to the hospital. Is it is a anxiety issue or it is an heart issue?
No, it's clearly an anxiety issue.
It's clearly an anxiety.
It's clearly an anxiety issue. So speak to your GP, and I think they will, family physician, they will be able to guide and direct. But it is what you are describing. It's clearly an anxiety about maybe the post-lockdown lifestyle, which the gentleman just earlier asked.
Okay. Thank you, doctor. Yeah.
I've got a question.
Yeah, please, please.
Someone asks, what are the coping strategies for those living away from home?
Yeah, absolutely. I think we need to be very mindful that although we are talking about families, many of us are living without their families. Uh, Again, I need to stress the fact that this is a temporary phase each of us are going through. And with the video calls, Facebook chats, WhatsApp Messenger, distance really is not, that big an issue for many of us. But obviously, being home, being surrounded by family members is something uh, compared to I'm sitting in a different city, sitting in a different country. But again, it's a time limited phase. It's something which we have to endure and yet be in touch and also do things. When we are alone, often we find ourselves, the whole structure of the day goes. We wake up at odd hours, we don't maintain a physical exercise routine. So my request has been to all these people who are spending time on their own, uh, is to have a very clear structure to the day. So wake up at the normal time, go to bed at the normal time, eat healthily, do a bit of physical exercise, what is possible within home, do your work, do a bit of reading, do a different variety of recreational activities. Often we are getting bored with too much screen time. So take some time off away from screen and do something new which we haven't tried and try to spend the time more productively.
Okay.
Thank you.
We have a question from Sanchita Gupta ji. She has raised her hand. Can you please ask? Sanchita Gupta ji, would you like to ask?
Hello. Hi. A very good afternoon to you, sir.
Good afternoon.
I wanted to ask about my mother actually. So she's around 57 years old, and
How much? What age? 67.
57. 57.
57. Okay.
Yes. And she's currently suffering from acute depression and anxiety also, I would say. Like she's having frequent outbursts of anger because of her past experience and certain regrets that she's having, and she has been taking sleeping pills for the past 20 years now, and now she has reached a stage that she's kind of immune to it. So that is also not working, and she has even doubled her dose. Even that is not really working now. So I'm sort of concerned about her health. And also there has been a certain experience that has caused a lot of change in her behavior, where her mother died 2 years ago, and still she's grieving about her. She still cries about this experience, and her behavior has become totally unstable. Like she becomes very hungry at 3 o'clock in the morning, and sometimes she sleeps till 1 o'clock, 2 o'clock in the afternoon. So I mean, I'm really concerned about her. Like, we try to take care of her like a baby, but that frequent outburst is really, it scares me out. So, what should be the remedy for it? So,
I think from what you are saying, there are a lot of indicators that she is quite unwell, emotionally
right,
quite unwell.
right.
And I was just wondering whether she has ever tried talking to a therapist,
We
because
have
she has
actually,
unresolved grief and
yes,
she
yes.
has, as you said, issues from the past. And I
Mhm.
personally feel that, if she's able to trust and find a good therapist, that would be
Mhm.
immensely helpful. Medicines only, I don't think, will be the answer here. And my request is to do locate a trustworthy therapist and encourage her to speak to that person.
Okay. All right. Thank you, sir.
Okay, we have Ritu Gupta who wants to ask a question. Ritu Gupta ji. We can't hear Ritu Gupta ji. Are you saying something?
Yeah. Am I audible now?
Yes, you are.
Yeah.
Yeah. Okay. Good afternoon, sir. So I just wanted to know one thing. It's about myself only. Since I'm like a social person, I like to socialize. I like to meet people. But of late, I realize that I avoid talking to people. I will not make an effort to call up and talk to my friends. So what do you feel like? What symptoms these could be? I really avoid talking to people over the phone.
I don't think we have to be social all the time, or we have to be quiet all the time. So uh, when we tend to define ourselves by these singular labels that I'm social, but I'm both social and unsocial. I'm both kind and unkind. So unless it is bothering you too much and otherwise you are feeling okay, maybe you just want some downtime. So one
But
of the
it's regular
favorite
affair, sir.
quotes. Yeah.
Sorry to interrupt you. It's not that during the lockdown, but it's a regular affair since quite some time.
Have friends also seen that you have become quiet and withdrawn? Are there
No.
other changes? Are you not enjoying the work you do? Are you not, are you okay with yourself? Are you happy or content within yourself? So I think that is would be my main question, rather than thinking whether you are calling up others or we're socializing or not socializing. Because
Sorry.
we go through phases, we go through phases where we want some alone time, we want some quiet time. You might be bored with the same crowd. You might be,
Yes, that
may
happens.
not be so enthusiastic about doing the same, having the same conversation in same parties with the same 15 people you see. So maybe it's your time to, try out new things. I don't know.
So as long as friends are not complaining, it's all right, right?
I think as long as you are not complaining, I wouldn't bother too much about friends. As long as you are happy and you are, chilled out doing whatever you are doing, go for it. Why not?
Okay, absolutely. So there is no psychiatric symptom as to that why I'm like keeping off myself with people.
Absolutely. No. Maybe you are bored. Maybe you find a new circle. Mr. Chawla will help you to find that.
Okay, thank you so much, sir. Thank you.
Okay, we have a question from Galaxy M30. That's what the name shows. Galaxy M30s. Can you ask, please?
Yeah, hi, I'm Sujata. Good afternoon. So
Hi, I can't hear you. Can you just...
I've unmuted myself. Can you hear?
Yeah, I can hear you now. Yeah.
So my question is that I have two sons, both in college, and my family, everybody is an out and out extrovert. We are very social all the time. We want to go out to party, have people over. And one of my sons is more introverted. He prefers to stay home, read a book, be on his own. So he enjoys going out, but he does not take that much initiative to make plans. As a result, I feel that uh, he doesn't have as many programs or going out as the rest of the family. Not that he's complaining, but I just wonder that if you have two sons where one is an extrovert and one is an introvert, and you see one having more of an outgoing social life, and both the parents are also all the time going out, and it's like this constant circus in the house. So do you think it's okay, or what are your suggestions?
I think it's absolutely okay. And I'm glad, you asked this, because a lot of parents asked us this question. One of the things which is very important for all of us to realize, that it is absolutely fine to be a shy and a quiet and an introverted person. And introverts are very misunderstood, because they do not kind of express themselves. They do not kind of go out and talk about a lot of things. So my request would be just to check more with your son periodically, because he might be having difficulty in expressing himself, that whether he has an adequate degree of friends, whether he is okay in school, whether he feels comfortable in a small group of circle, and just keep more tabs on him. But please don't force him to do things which he doesn't want. I think that is very important.
It's like he is happy, and touch wood, there are no complaints from school or college. But it's more that I feel that, why is he different from us, rather than him having any problem which he's voicing. It's just that I feel he's not enjoying so many things which, young people should want to go out more, should want to socialize more. So I don't know whether it's a real problem or
a lot of quiet people. About conservatively, we see out of 10, 3 or 2, about 25 to 30% of us are introverted or quiet people. So don't worry about that. As long as he's happy, he's communicating with you. Don't.
Okay. Thank you so much. Thank you.
Thank you, ma'am. It's such a wonderful question. In fact, I was just wanting to request doctor to come into this topic of introverts, because that is a very interesting and a very diversified topic. How does one identify the features or these aspects of an introvert, and then how should one deal with it in such a way that he does not go out of control or he does not start panicking? I mean, mostly the parents are the ones who start comparing an extrovert with an introvert, or they start expecting an introvert to behave better than an extrovert or more like him.
I think the first thing is to let introverts be, and introverts are just, we often think that, obviously society rewards extroverts more because they will be speaking more, they will be taking the lead, they set the agenda. But I think in a world which really cannot stop talking and publicizing about ourselves, we do need introverted people to keep the balance and also do the kind of the more meaningful thinking things. I'm not saying that extroverts don't do it, but I think we would be doing a great injustice to people who are quiet if we force them to become extroverted. So just explain it to them that you understand that they are this kind of a person, if your brother or your sister or your son is like that. And if there are any problems, if there are concerns, they can come directly to you and share your thoughts. Don't force them to be very gregarious. Don't force them to do things, because otherwise it might cause more harm to them. The key thing is for all of us to understand introverts better and just let them be, and not label them as someone who is abnormal. I think that is what our greatest danger is, because we want everyone to be extroverted. I read this very interesting interview where Shah Rukh Khan said that I am an introverted person. Many of the artists, many of the actors, if you read their interviews, they say many of the creative people actually are introverted people, because they spend a lot of time in their own minds creating things. Many of the, famous authors, many actors whose interviews I have read, they have said they're introverted people. So introverted does not mean that when it is needed, they cannot make a powerful presentation. They can't do things which we want them to do. But they just don't like small talks. They just don't like going to the same parties and having meaningless conversations. So let them be.
Okay, so and how does a parent deal with them? You said about we want to understand their perspective, what they think, and why is it that they are like this. I mean, we don't know. We want to understand their perspective more than ours, because as you said, a parent, okay, fine, as a parent, we can understand, okay, fine, let them be. But what is their mindset? How do they
their
believe?
Mindset, they are, if you speak to introverted people are quite happy in their own company. They are quite happy in very small social groups. They are happy being quietly reading or listening to music. They are quite happy reading a book. So they don't need to, suppose I have a need to go to parties and, be seen, but they don't have that need. So just understanding them that biologically their brain is different and they do not crave for company is just enough.
So it's by them, they make a self-contented atmosphere around themselves and they're happy within it.
Absolutely. It's an orientation, it's an orientation. Like, I like this kind of music. I like this kind of people. This is my, sexual orientation. This is my religious orientation. So it's a kind of way of life for them. So we should not force and change.
Okay, we have a question from Anju Basari ji. You want to ask a question?
Can I just mention one thing? I think most of the times when we see problems are really newly married couples. If either of the person is introverted, and I think in our society, when women are most frequently misunderstood if they are introverted, they would be labeled as ice queens, snooty, snobs. But I think we need to understand that there are different varieties of human beings. Not all of us can be fitted into one mold. So all of us have to make more effort to understand people who are not like us, who are not extroverted. Sorry, I interrupted a question.
Oh, perfect. We have a question from Anju Basari ji. Please ask.
Yeah, hi, good afternoon.
Hi.
Hello, yeah. So recently my daughter was diagnosed with ADHD. So do you have a straight line treatment for ADHD or like medication or just mental exercise, going to a therapist?
There are a lot of, if I am allowed to use a scientific term, ADHD treatment is known as multimodal treatment, meaning that there are many methods of treatment which has to be done simultaneously. Medicine can be a part of it. It may not be a part of it, but it can be. So majority of the children we see have to go through counseling, have to go through parent training. Their parents need to know. And if those initial measures don't work, then only we give medicines.
Okay. Thank you.
Okay, we have Sanchita Gupta here. She had raised her hand. You want to ask, please?
Yes, I wanted to ask this question. Actually, I've joined in a little late, so I don't know if this question has already been asked. Can I just put forward the question?
Yes, please.
Yeah.
So I just want to know, doctor, that sometime when I'm a little anxious, maybe, I get a little, breathless. And I just feel a little like maybe my head is not, I feel a little kind of a vacuum maybe. And that's for a very little short period, maybe half an hour or something. What I would like to know, and it gets okay on its own, like I don't have any medication or something. But what I would like to know is during that short period of maybe that anxiety and breathlessness, does it affect my heart or my lungs or anything? I mean, should I get it checked or something?
No, you don't need to. What you are describing is a mild anxiety attack or a very mild panic attack. See, essentially what happens is that when we are feeling anxious, there are certain chemicals which are released in excess in the brain. Okay. So those chemicals produce these physical changes. So suppose I'm feeling scared, I start trembling and my hands sweat, my heart rate increases. So what is happening that there is directly a link between the brain and our body. So because of anxiety symptoms, these chemicals are being released in more amounts than what is required. And those are presenting these physical changes, and it automatically goes away. The best way to deal with it is to do deep, regular breathing exercises, yoga, pranayam. Those help a lot in settling these kind of panic attacks. And also avoid caffeinated drinks, coffee, cold drinks. If you are a smoker, it's best to avoid those. So.
Yes. Thank you so much. Thank you.
We have Sujata Rampuria ji. She wants to ask a question, please. Sujata Rampuria ji, are you there?
Can you hear me? Okay.
Yes.
I have two sons who are 14 years and 10 years old, and four of us, we are quite enjoying the lockdown. I have seen a different side of each member of the family, but the problem I'm facing is that, all three of them, the three men in the house, they are happy doing the same things, and I always feel that I need my me time. and they are not happy with it. Like for instance, if three of them want to play cards and I want to see a movie on Netflix, three of them will complain together that why can't you spend time with us? And it's happening all the time. So is it something wrong with
सबके साथ हो रहेगा.
So they want your company. So you should,
But all
I
the
understand that. I think they love you more than you had bargained for. So that is.
all the time. And it's always this is all three of them want to do one thing and I want to do the other thing. Always.
True. No, I think you need to be very clear, saying that I need some me time. I want to watch this or do that, and please kind of give me. And I think it has to be a part of the whole day that you say that for this amount of time I will spend with all of you, and with this amount of time no one can bother me. So, otherwise no food, or you lock down the kitchen.
Good one.
So if they are wanting company, why don't you join in kitchen there?
Yes. At the end of the day, they want me to watch a movie with them or play cards with them, and I always want to do something different.
Okay, we have a question.
With me.
Sujata ji, are you satisfied with the answer?
Oh yes, I am. Thank you.
Okay, can we go over to Arun Agrawal ji? She has a question to ask. Arun Agrawal ji, are you there?
Hey, Dr. Ram.
Yeah, hi.
Okay, before that, can I request to switch off your videos? There's a bandwidth problem happening. We are not able to communicate properly. Everyone else, please switch off your videos. We are having bandwidth issues.
Okay, so I've got a weird question, Dr. Ram.
Please ask.
COVID situation. Can you hear me?
Yeah, I can. There's a slight echo. Yeah.
Okay, so with this COVID situation, what has happened is, I have fairly well tackled it with some spiritual music and all, and then, my work. But some of my friends are actually almost devastated, and they are really complaining all the time. Tackle this, what will happen post-COVID. So how do you suggest I talk to them? Like, assuring them is probably like babysitting, they don't enjoy this. How should I do this discussion?
I will just repeat the question if I got you right. Your friends are worried about the post-COVID situation, and so you are asking how you can help them or counsel them.
Because they are feeling that the business will be closed or they will incur heavy loss. What should they do about it?
Yeah, I know. I think this whole economic impact of COVID, we are going into unknown territory, isn't it? And it is very hard to reassure someone when there is such anxiety looming in the foreground. The way I see it is, again, this is a very, very personal view, that there is only so much we can do. Beyond that, despite our best effort, we can't do. So the businessman part of us wants things to be as usual. But the human part of us tells us that it is not going to be so. So how do we reconcile the business part of Ranjan Ram and the human part of Ranjan Ram, I think is the question. And my own, what I have been doing is to just accept the fact that we will do our best, I will do my best, and hopefully I will be able to maintain the same lifestyle. But if not, then I have to live with it, and so be it. But this is not the end, this is not the end. We have to change our ways, and we have to recreate, think of new things, and adapt. In one of my favorite movies, Dev Patel always used to say that if it is not, if it is not well, if everything is not well, then it is not the end. So I think towards the end in this journey, we will be able to find our feet again.
My dilemma is slightly different. Actually, if I kind of tell them that, okay, chill, brother, no, don't worry, then he says,
no, you can't say don't worry. Why will you say don't worry? their worries are genuine. Suppose if I am asking you, I'm saying that so you have to say that this worry is very genuine. See, one of the biggest mistakes we do is to say, don't worry. I have a problem, I will worry. You're saying don't worry doesn't help me. So I would like to hear that yes, it is a worrying situation. I can help you as much to the best of my being your friend. I will help you as much as I can. I'm next to you. Even if you kind of next time do not offer me single malt, I will still be your friend. Even if you do not go on fantastic holidays, we can go to Digha or Puri, I will still be your friend. We will have, chuda or something together. So, life will be, human-wise, it will be the same. Maybe whether I am using a Gucci or I don't know, a Bata shoe is a different matter, but the souls will be the same. I think that is what I would like to hear from you.
So basically we empathize but don't sympathize.
We empathize, we don't sympathize. And don't ever say that don't worry.
Yeah, I understand. Thank you so much, sir. Okay.
Yes, I have a question, please.
Yeah, sure.
Yeah. Many a times I feel very insecure from inside. My heartbeat increases and I feel a burning sensation in my spine. That is not for a specific thought. It happens now and then. So how to deal with that feeling of insecurity?
We need to go into a bit more details about, I think, why are you feeling insecure? What is causing it? Your life circumstances? Is it something new which is happening? But obviously, it is serious enough to cause you some physical symptoms also. So my request is again would be to speak to your family physician, maybe speak to a counselor and sort things out. See, what is happening is that there are things in your mind which you are unable to find answers or resolve. And it would be very useful if you saw a therapist.
Okay, thank you so much.
Okay, we have a quick question. I am low and morose, feeling that I am not able to make the best of this free time. I don't know what to do. I'm trying to meditate, read book, and watch movies. Learning through online courses too. But nothing is giving satisfaction. Do I need psychiatric help?
Not at all. I think you are trying to adapt to a new living circumstances. The best part is that you are trying. And remember, nothing goes to waste. So whatever you are trying, maybe if you have done one online course, even half of it, you learn something new. So I wouldn't say that don't feel disheartened, keep trying. And
there is second part to it. He's away from home.
Okay. I think that is causing that. Absolutely. So I think you are missing home. But again, my request is keep on doing the things you are trying to do. See, physical distance is a problem as we discussed, but there is ample opportunities through video calls to be as close as to home. So keep on trying, and this is a time limited phase. You will overcome it.
Okay. Next question is people who have psychiatric problems and are generally in their high and are advised to take medication, but they do not take medication. And they're also getting counseling done. It is definitely not helping. How to go about it? So all these
I think this is a complex question. I think you are referring to bipolar mood disorder.
Yeah, I repeat the question. People who have psychiatric problem is generally in their high also and also advised medication, but is not ready to take it.
Yeah.
Counseling is definitely not helping him. How to go about it?
Not taking medicines is very, part and parcel of many of the psychiatric illnesses because they don't have insight. And I think there are no easy answers to it. Most people don't want to take medicines for a variety of reasons. So what we usually do is to engage them in a conversation. My reason for not taking medicine will be different to Mr. Chawla's reason for not taking medicine. So if you see 100 people, 100 of them would have different reasons. So we need to go to the very specifics of it. many people have very genuine reasons for not taking medicines because it makes them feel groggy, sedated, drowsy.
No, in this case, I just got the message from his mother. The mother says that he is adamant not to take. He thinks that I am absolutely normal and I don't want to take. So there is a debate. So
yeah, I think then counseling from a experienced therapist or someone senior psychiatrist is needed, because this person needs to be convinced that he is harming himself by not taking medicines.
Okay, get it. If frequent anger is another question, this is another question. So the first answer that you said is that he should be visiting for more counseling. Because he should be told that he has some issues which he has to address.
Yes, yeah.
Then we have another question: if frequent anger is a form of depression, or if it need treatment only within relationship, not with outsiders, not one relation but most. I mean, basically they are trying to say that he is frequently angry at home mostly. So what is it? I mean, is it a form of depression or what? How do they address it?
I think most of our emotional symptoms are obvious in close relationships, in our close confiding relationships. So many of us express our hurt, anger in intimate relationships. So and most of us, we would be absolutely fine to the outside world. So there must be some inner problem, psychological demons which is affecting this person. There might be aspects of the relationship which is causing unhappiness, or very frequently what happens is that we carry shadows of our past relationship and bring it into the new relationship. So suppose I'm giving you a very bad example. Suppose if me and Mr. Chawla were business partners, and I duped Mr. Chawla of huge amount of money. So when he goes into the next business relationship, he will be very suspicious, and he would be checking on his new business partner, which would be causing conflict. So we all carry shadows from our past relationships, which affects our new and ongoing relationships. So maybe there are problems in this person's mind with respect to the relationship which needs to be delved into.
Okay. We have Mamta Jalanji. She wants to ask.
Yeah, can you hear me?
Yes.
Yeah.
This is a very tangential question, but I mean, it relates a little more to the corporate scenario. But have you dealt with anything ever related to, obsessive emulation, in the sense that, okay, there's something that I've had to face a couple of times where either your superiors or your juniors, etc., across would emulate you to the extent where it gets a little scary.
That it gets to?
Gets a little scary.
Yeah, that's an interesting question. I think we all hero worship or idolize people. I was just listening to Irfan Khan's one of his past interviews, and he talked about one of his acting role models, and he would do everything like that. So I think if it borders on intruding on the privacy of the person,
it does
then
sometimes.
only we will be. I think it's a very fine line, and if you feel uncomfortable about it, I think you have every right to put it across.
How do you handle this? I mean, I find it difficult to handle sometimes.
I think one is maybe speaking to other colleagues and finding out whether they also feel the same. So it may well be that you might be, overthinking. So speak to a trusted colleague and ask that person to observe this person's behavior, and then have a feedback. And then maybe in a non-threatening, maybe in a group setting with 2 or 3 trusted people, have this conversation with the other person who is doing this in a very gentle, in a very.
I understand.
Yeah.
Yeah, but do you think this is usually a result of an overwhelming personality?
Could be, or I might be needing some affirmation. I might be needing that, yes, positive strokes from you. because you are so wonderful, or at least I think you are so wonderful. So I'm following you slavishly, whatever you are doing. I'm trying to do things to impress you, not realizing that I'm crossing the boundary.
Oh, okay. I mean, initially it can be pretty flattering, but it does get scary at certain points.
No, absolutely. And I think it becomes too much, really, because too much, what would I say, too much positive feedback and too much emulation also kind of feels, we don't like people to become very clingy, that constantly they are seeking affirmation and all that. So I think you need to gently put that point across.
Thank you so much.
Are you well answered, Mamta ji?
Very well, thank you.
Okay, we have Preeti ji. She wants to ask a question. And Preeti ji, where are you? We are missing you here.
I have seen Preeti. Yeah, I got a
She was here. She is. Preeti ji, are you there?
Yes, I am. Hi,
Okay,
Jay.
good.
Hi.
Since morning.
Yeah. So I was just asking, this is quite actually from loads of my friends. They just say their in-laws or their parents, suddenly like last few years, they are behaving in a certain way, and she has to look after them far more than earlier. And they are not very sick and all, but somehow, I don't know what exactly it is, but
more
they
attention seeking.
They don't have much problems or illness, but somehow they are behaving in a certain way, which they are not telling me exactly what way, but they are concerned.
I know, Preeti, what happens is many of what we have seen as people grow old, they feel redundant. They feel that no one cares about them. And one of the ways they feel that they will get attention if they complain about their health, if they complain about their sickness. So suppose I'm old and I tell my son that, you're not looking after me or you're not spending quality time, he might give me 20 million reasons why he is busy. But if I say that I have this chest pain and I have this back pain and I've got to go to the doctor, so I will keep that person engaged in the conversation. So often it might be a way of keeping the other family members involved, because the elderly in the family, they feel they are not getting enough time. So this again is quite common.
Yeah. Thank you.
Spending some dedicated time with them doing things.
I remembered a chapter when we studied in school. बुढ़ापा बचपन का पुनरागमन होता है.
Absolutely. Yeah.
They become a child, absolutely a child. And if you don't give them attention, they just feel because of course you've gone up busy at this stage. So it is a question of many people right
now. Do the same when we grow up. Huh? Okay, we have a quick question coming from on the chat by Swati Chavaria ji. She says, my question is, to what extent should you intervene in your teenage child's decision to choose a particular career?
My God, this is a...
Yeah, you want to let
them... You are expert in it.
You want to let them choose for themselves while they are also too young or naive to think for themselves what is the right approach. I mean, basically the child-mother relationship comes in where the career has to be decided. How do they handle it? This is a very, very important question. I mean, we should get into this pertinent question here.
Yeah, I have got something else from 1:45, so I have to finish.
Okay, I'm so sorry. We didn't realize we are already through 1.5 hours.
1.5 hours.
We have 15 more minutes. We have 15 more minutes.
Yeah, few more minutes. Yeah. See, this is a very, very difficult question, and I have to give a very disappointing answer because there is no absolute yes or no. See, many children, they are not good judges of what career to choose, because they may have a very biased approach, or they might have heard from someone that this is a useful line or this is a glamorous line. So therefore, once we have these kind of problems, what we try to do as mental health professionals, we go into a very detailed conversation with the child regarding what is understanding about the future based on the career he wants to have. And some children, they give a very accurate answer and we ask them to do more research before we allow them, or before parents can allow them to do it. And so that is one part. So you need to have a very detailed conversation with your son, checking out what is imagined future. Whatever he is thinking, is it realistic or not? That is number one. Having said that, I am terribly disappointed every day in my work when I see parents forcing their choice of subjects on children. You know, the number of young people I see who come to me very dejected, heartbroken, because they have been forced to study science. And I hate saying this, and you know, we Indians have this great thing about science, that unless science, you study science, you are not a bright person and all that. So so I think we need to also be very careful that we are not imposing our own aspirations and hopes on the child and forcing them to do something which they don't have an aptitude for. So it's a fine balance. It's a detailed conversation with both the parents and the child. And then only we can come to a decision.
Okay. Next question is, any special advice for new mothers who may be locked at home with their newborn baby?
I think it is from Anisha. Yeah, Anisha. Yeah. I think it's a very difficult situation. Yeah, I think it's a very difficult situation. How do you, can you share the child caring responsibilities with someone else, at least for a few hours? Is it possible? Number one. Hopefully your husband is also, your partner is also at home. Can you definitely give him some responsibilities so that you have some me time, sharing the burden, and when the child is sleeping, maybe doing things which you like and not serving other members of the family. I think those are very important.
So basically, you know what, Dr. Saab, what I see during this course of discussion, I realize that this particular field does not give an instant solution.
No.
We have to believe in what we are doing over a long period of time, the solution comes forward. And we are so used to instant solutions that we have come to you, give us a medicine. We have come to you, give us an anxiety pill. We have come to you, give us some disturbance traumatic pill. So this is actually very difficult. I can see it's very difficult. The questions are very, very serious. I mean, in a way, these questions are so serious that they can lead to problems in future. But there is no solution like this. Instant solution nahi hota hai.
No, absolutely. There are no instant solutions. Absolutely. It's not Maggie.
Yeah. Anyway, Dr. Saab, we are, since you have a shortage of time and we don't want to let you go, honestly speaking. We're enjoying this conversation that's going on. But would you like to flash some number? How do they communicate with you in future?
Okay.
Is there a way to communicate with you?
I'm there. Yeah. Can I give one number? 833
833
700
700
41
41
23
23.
That is my secretary's number.
Okay.
And he is very, very good. So he often
Can I repeat
answers
the
the
number?
phone on the, yeah.
I'll repeat the number: 8337 004123.
Yeah.
Kavita ji, are you there? Could you please
Yes,
share it?
yes, I'm there.
Could you please
I'll
share
do
it on
that.
the chat?
Yes,
Did you
yes.
get any question that we missed out on, Kavita ji?
No, there are no such questions. All questions have been answered.
Okay, we have two hands raised again. Can we take these two questions, Dr. Saab? The last two questions.
Yeah, sure.
Okay, one is Ajay Gupta ji. You want to say something?
Hello, good afternoon, Dr. Saab.
Good afternoon. Good afternoon.
I have heard somewhere कि दुनिया में जितनी भी बीमारी होती है, all is related with some psychosomatic type. Is that true? And आप इसके ऊपर कुछ कहना चाहेंगे?
I think many of the brain diseases have origins in the brain, and you know, the brain and mind, the brain and body, or the mind and body, they are intimately linked. So in some way or other, psychosomatic, again, I'm going into this very long, this is a favorite topic of mine. See, only the Western medicine forced us to treat mind and body as different. If you see the indigenous medicine, mind and body, they are the same. So everything is linked together. So you really cannot have a bodily disease which does not affect the mind, and you cannot have a mind disease which cannot affect the body. Both are actually the same.
Okay. We have another question from Mamta ji. You would like to
Thank
ask?
you.
Hi, my father has palsy, cerebral palsy, but at this point he's like he can talk, and of course he has a little bit of a problem in terms of expressing himself. But one thing that we've noticed, which has grown over a period of time, is that you can see him expressing a lot of anger. Not all the time. I mean, he would laugh and there would be other things also, but then he has a lot of anger. Do you think this could be a resultant of an impending depression? Or
Could be. You know, often if someone has any stroke or any cerebral issues, they might be frustrated about their disability and they can express it through anger. We often express our disappointments through anger. I'm frustrated at something and I project my anger at something else. So
with this kind of a condition, how can one address it?
if it can be, again, basically all these conditions are very amenable to treatment, either psychotherapy, counseling, or low doses of medicine, depending on how severe it is.
Okay.
Mood swings are very common in people who have cerebrovascular problems, cerebrovascular accidents.
Okay. Thank you so much.
One question from my side. I want to understand, how do you calm yourself? What do you do? You sing, or what do you do? How do you do?
No, I enjoy kind of talking to people. So I enjoy the work I do. And, you know, there are many positive blessings of the work. So that keeps me going. And I have also a very mundane, boring lifestyle. So I like working. So
any particular, are you an introvert or an extrovert by nature? What is it? How do you define yourself?
I like talking to people. You know, I possibly, I'm definitely not an introvert. But I'm quite happy to be on my own also. So.
Okay, great. It was a wonderful session with you.
I've got a,
it was just
I've got a question.
Yeah, please ask.
Yeah.
Hello.
Yeah.
There's a question. How do you deal with people who are just behaving like tragedy king or queen, especially pertaining this current situation, rather than dealing with it in a practical manner?
They're dealing as a tragedy king.
King or queen, yeah. Tragedy king or queen.
I think they must be having some reasons. I think, you know, we need to give them the benefit of doubt. I might be appearing very sad, unhappy, miserable, but I'm not able to share why I'm feeling so. So give them benefit of doubt. Don't come to a judgment that they're acting and they're not serious about what they are saying.
I just got a call from somebody in Mumbai. She wants me to ask a question to you. She suffers of the social anxiety or the fear of interacting with people, or this inferiority complex or whatever. All this put together, she calls it a social anxiety. How does she deal with it?
See, social anxiety is a recognized disorder. Social anxiety disorder is a recognized disorder. People are very wary of going in groups, eating in groups. Women have it more. So therefore, again, psychotherapy, counseling is very good. Going out in small groups and addressing your fears, which are, you are finding difficult to deal with, is good. Often it is good to have a buddy system. So take a good friend of yours to social situations where she can or he can rescue you, and expose yourself to social situations in small doses and gradually increase it. And there are many ways to deal with social anxiety.
She is 55 plus, and I think she still is very anxious when she's out. She does not start a conversation. She wants to hear more than talk.
Often people do therapy sessions, role plays. So you would be doing role plays where you would be acting out social situations. Take a good friend of yours who can guide you through the process. So it is a difficult situation to deal with, but it can be overcome.
Excellent. Your session has been so good, but a question khatam nahi ho raha. Renu Agrawal ji,
other people are calling me. I need to be through in another Zoom meeting from 1:45.
Okay.
So,
Renu Agrawal ji, I'm so sorry you were late in this question.
We can have another one if people want me back. So, yeah.
Yes, we would like to have you back again. Your session was excellent, and we've had this interaction so good. Thank you so much, Dr. Saab. I will not stop you now. Thank you so much.
Thank you. Bye.
Thank you, sir. I think it was a great session. Thank you all for being there. Kavita, thank you. Thank you, Kavita ji. Ravi, thank you. Manoj, thank you. And thank you all of you for being here. Do come back here tomorrow. We have something on. Hi, Preeti ji. Thank you so much.
Sorry about the delay. Too much delay today. Sorry.
I know we've had tremendous pressure on this net also. It's not been doing well today for some reasons. And now I don't know how it will continue like this. We have a session tomorrow on eyes by Dr. Nandini Ray. She's going to talk about eyes.
Okay.
And you can ask all questions related to eyes and how to take care of eyes at different ages. Right from when you're born till the end, how to and what are the things we have to take care of, and how to get these tests done, what tests to look for. So the session for tomorrow is eyes. Do come back in. We have Dr. Nandini Ray talking about it. And thank you once again for being here, all of you. Great to have you here again and again. Thank you, Vivek.
Thank you.
Thank you,
Thank you, everyone. It was a wonderful session. Thank you.
Thank you so much.
Bye.